morning, everyone. Thank you so much for joining us. My name is Darian Jones. I'm the Caregiver Education and Digital Specialist at Care Partners. We have another very special guest today for our Hot Topic segment. We have Dr. Priyanka, I'm going to do my best to say it correctly, Chakrabarti, and she's from Iora Primary Care. She's here to tell us about how to stay safe and healthy during the coronavirus. And without further ado, we'll just bring her up. Hi, how are you doing today?
Hey, good. Thanks for having me.
So today we're going to be talking all about COVID-19 and just all the different things we can do to keep safe. So everyone at home, we know you have questions about this, so we'd love to hear them. Please, at any time, just jump in and comment your questions below, and we'll take some time to answer any questions you have about this. And even if you don't have questions, we'd love to hear. Just say hi, let us know you're there. Even just let us know where you're watching from. The first topic that we're gonna kind of go over is some of the new CDC recommendations. But before that, do we want to just introduce yourself a little bit and tell us about yourself?
Yeah, so I'm Dr. Priyanka Chakrabarti. I'm board certified in family medicine. And as you said, I work for Iora Primary Care here in Houston, seeing adults on Medicare.
Perfect. And then, yeah, I guess we'll just go ahead and get started. So can you tell us about some of the new CDC recommendations? There's been a little bit about not wearing masks, and now they're kind of saying to wear masks. So can you kind of help us understand that a little bit better?
Right. So as you all know, COVID-19 was a new virus that came out last year. So things have been changing as we've been learning more about how it spreads and how it gets people sick. So because of that, a lot of the guidance has changed over time. That one of the most important being whether we should wear masks or not. So as of now, the CDC does recommend masks for people that are going out in public, especially in places that could be crowded, like the grocery store or the pharmacy. I know that's different from a few weeks ago. Something to keep in mind, though, is it doesn't mean you need the N95 or surgical masks like healthcare providers are needing. There's been a shortage of that, and even for hospitals, they're having trouble getting enough. But for people out in the general public, a cloth mask is fine. And there's instructions on the CDC website about how to make one that's effective. So the main things to keep in mind with the mask is you want it to cover your nose and your mouth. And you don't want to touch it either. You want to limit any touching of your face when you're out in public, and that includes the front of the mask. So those are the most current guidelines.
So sorry, I had my microphone off. Can you tell us a little bit about how you can safely unpack groceries and packages at home?
Right, so there's been a lot of focus on this, mainly because there's information coming out that the virus can live on different packaging materials and for a different amount of time. So the main thing is just to practice good hand hygiene, which I think we're going over a little bit more later. But whenever you're handling any packaging, you want to wash your hands afterwards, especially before you eat. As far as the FDA reports, there haven't been any cases in the US from packaging or groceries yet. But if you're concerned, you can always wipe down the packaging when you get your groceries or any packages delivered to your house, or just take it out of that packaging, put it in something that you have at home and get rid of it, and then wash your hands.
Yeah, I know that there's been some confusion about that, or some worry about that too, where people are concerned about cross-contamination or just getting packages from the mailman or something, and people being worried about that. But you said that COVID doesn't really last on surfaces that long?
It lasts on different types of materials for a different amount of time, so it's good to be cautious, but doesn't mean you have to be very paranoid about getting packages or groceries.
Okay, that's really great to know. Another thing that we'd love to hear some more about is the hand hygiene that you were talking about. And one thing I'd love to hear a little bit more about is the cross-contamination of people wearing gloves out in public. Can you tell us a little bit about that?
Yeah, so there is a right way to wear gloves, but let me start with the hand hygiene part first. So, hand hygiene just means trying to keep your hands clean as much as possible, especially when touching something that isn't yours. So, this comes into play when you're out of your house, like going to the grocery store. Things that are effective in cleaning your hands are to clean your hands with are hand sanitizers with 60% ethanol or alcohol. That works just as well. You can keep that in your pocket or in your purse. And anytime you touch something, or if it's been a while since you've last washed your hands, making sure you're not touching your face before you wash your hands. You can use some hand sanitizer to clean any germs off your hands before doing any coming into your house, or if you have to touch your face or anything like that. And then just hand washing with regular soap and water is just as effective too. So if you don't have hand sanitizer, that's okay. Recommendations would be to try and wash your hands with hand sanitizer if you have it, or soap and water before you get into your car, but definitely first thing when you get home so that nothing that got on your hands is spreading around your house. For gloves, although people have been great about wearing gloves, there is a right way to do it. So when you're putting on gloves, you have to consider the outside of the gloves as dirty. So it's going to be just like having dirty hands. So anything that you touch with the gloves could potentially have virus on it. So that's also something you want to keep from touching your face, touching the food you're going to eat, wearing it inside the house, and touching things inside your house. There's a lot of photos and videos of people, opening a bag of chips and eating it with their gloves on. That's not the way you're supposed to use that. You want to take the gloves off before you do that. And what you can think of is the outside of the glove is dirty, but when you take the gloves off, your hands underneath are clean.
Yes, I think that's a great point. You're talking about stuff on the internet. I saw one picture of someone who was wearing gloves. They were in Walmart or something like that, standing in line. And he took off his glove and he had it in his mouth and was on his phone. And I was just like, oh, man.
It's great if you're wearing gloves, but there's a right way to do it. If you're not doing it the right way, some people just might want to stick to hand sanitizer and washing their hands, because if you're wearing gloves and doing it the wrong way, you can still catch something.
Yeah, I think the most important thing to remember is just everyone should be washing their hands as much as possible. So then I guess we'll move on to this really important topic. So what would you recommend for people who think they've been exposed?
Yeah, so that's a good question. So this has also been changing as there's been more access to testing. As many people know, a lot of cities weren't prepared with the tests that they needed to test the people that thought they had COVID or thought they were exposed, and that's slowly changing. So the first thing, if you're sick or if you think you've been exposed, I would recommend calling your doctor's office. A lot of doctors are doing virtual visits now. That's why I'm at home too. And we can definitely help guide you through what to do next. In Houston, recently, they opened up testing to everybody. It used to be that you had to fill out some type of online questionnaire or some questions over the phone to see if you were eligible for testing based on your symptoms. That's been taken out. So now anyone can call the phone number from the city of Houston to try and get a number to get tested. If you're not certain if you need to be tested, if you're worried about waiting in the long lines, or if it's going to help you, just call your doctor's office and we can definitely help guide you through that.
Especially if if you think you've been exposed at all, it's really important to just probably get in contact with your doctor and follow their advice.
Right. Keep in mind too is if you think you've been exposed or if you're feeling sick, go ahead and just quarantine, which means limit your exposure to other people. Try and stay in a room away from the rest of your family until you have further information on what to do.
Yeah, and that was something I'd love to also talk about. Can you explain a little bit the difference between some of the different terms that are being used right now, the self-isolation, quarantine, and I think there was one more. But would you mind explaining that a little bit?
Yeah, so there are a few. The main ones to remember, there's three, is social distancing. That's what everyone's being asked to do. So that's this whole limiting gatherings of more than 10 people, trying to limit how much you're out of the house, trying to work from home. That's all social distancing, and that's something almost the entire world is practicing right now. Then there's home isolation. So home isolation is usually for people that may have been exposed but aren't sick. So it would be staying at home, usually for up to 14 days. It would change based on the guidance of your physician. And some of the things I was mentioning earlier, staying in a room away from the rest of your family unless the family's already been exposed to, trying to limit your contact with other people so not to spread the virus. And there's also some guidance on different hygiene, like using different plates and spoons than the rest of the family, trying to use a different bathroom if possible. And these are all things on the CDC website. So if it was to come to that, you can get that information from the website or from your doctor. So the third piece is home quarantine. Very similar to home isolation. It's just the term if you've had symptoms. So if you're sick, how to limit your exposure to other people and stay at home. So a lot of it's very similar. It's staying in a room at home, trying to wear a mask when you're outside of your room so you're not spreading to others, and also trying to use a separate bathroom if possible. And this also has a one-page guide on the CDC website if you're curious, or if it comes to you being instructed to do that, you can get more information on their website.
I think that's another really important thing. One of the best resources online is going to be the CDC and the World Health Organization. They're constantly updating and monitoring the virus. I'd love to know, where would you say that we're kind of at with this coronavirus situation? Is it going to be going on for a lot longer? Do you guys know?
So there's still a lot of unknown with that. In Texas, from things that we're seeing, it seems we haven't quite reached our peak yet. Like things you're seeing in New York with so many cases, they're a bit closer to their peak or have already hit it. Houston's estimated, or Texas in general, is estimated to be a few weeks away, so end of April to early May. How bad that surge or peak is going to be, we don't know yet. It's going to depend on how good of a job we've been doing preventing the spread and keeping people safe. So there's still a little ways to go, but there's a lot unknown. Sorry, my cats are out and running about now. They got out of
I've got cats too. I completely understand.
They got out of the study. Sorry about that.
No problem. Yeah, I think it's important for us to remember that we can do our part, and that's going to be the social distancing, the self-quarantine, and the washing of our hands. And if you could say there's like one big main takeaway, if people remember only one thing from our conversation today, what would you say the best thing to remember would be?
I would say that although it's a really uncertain time, there's a lot of fear out there over what's going on. There's still a lot in your control. So to remember that and try and control the factors you can, like your exposure, trying to practice good hygiene, trying to wear a mask. These are all things we can do to protect yourself. And not just that, but also others, like your family or anyone that might be immunocompromised, meaning having a weaker immune system that you're around. So things aren't as helpless as it may seem when we watch the news and hear stories of people getting sick. Secondly, that everyone's in this together. So we're all going through the same thing. Social distancing is hard, and that's not talked about a lot, but there are definitely resources out there for people that need it. And that's also something your doctor's office can talk to you about. It's very normal to be having a hard time with this right now. So that's also just as important as reaching out as if you feel sick and think you're exposed.
It's so important to still try and stay connected as much as we can, even during this time. We'll take a quick look at the comments, but we just had a couple people. We have Ivan. He says, very helpful information. Thank you. And then Caitlin, she says, this is some great information. Thank you. So we are so grateful for you taking the time to be here. And we also have another one. Kathleen just commented. Thank you, Dr. Chakrabarti. Great info. So we really do appreciate you taking the time to be with us today. That was some really, really important information. And like we said, some other great places for resources would be the CDC and the World Health Organization. And with that, we're going to say goodbye to Dr. Priyanka today. But thank you so much.
Thank you all.
And we just want to remind you guys, Care Partners is also monitoring the coronavirus situation. We have a lot of information on our website. This address, you can go to carepartnerstexas.org, find Help Common Ground. We're doing a phone teleconference Common Ground support group twice a week. So we actually had one today at 10 a.m. and we're having another one at 2 p.m. on Thursday. And we'd love to hear what you guys have been up to. What have you guys been doing to stay entertained or just keeping yourselves busy? If you guys want to send some pictures and share your stories with us, you can email info@carepartnerstexas.org. We miss you guys so much and we can't wait to see you guys back at all of our programs. But until then, we will be back again tomorrow with some more Hot Topic Live segments. So have a great day, everyone.